Hello, this is Dr. Ori Birdsong, Corneal and Refractive Fellow at Hoopes Vision, here to show you a case of a combined LASIK and KAMRA insertion using the Alcon FS200. After standard docking procedure, a temporal corneal stromal pocket is created at a depth of 235 microns. To allow for the resolution of the opaque bubble layer, a 20-minute interval was allotted at this time. After redocking, a standard corneal flap was created at a depth of 95 microns, followed by the lifting of that flap with a corneal flap elevator in a routine fashion. After centration was confirmed, the excimer ablation treatment was performed, followed by the rewetting of the corneal LASIK flap as well as the corneal stromal bed, with careful placement then to reposition the corneal flap onto the stromal surface. The patient was then moved to the Leica operating scope. Also at this time, the patient's preoperative HD analyzer results were reviewed. This was to ensure that the KAMRA marker would be placed on the central Purkinje reflex. A crystal violet marker was then used to mark a 3.8 mm Tomita ring marker, and a corneal mark was placed as seen. Afterwards, a Tomita intrastromal pocket dissector was used to help dissect the corneal stromal pocket where the KAMRA inlay was to be placed. The inlay was then loaded into the loading forceps. With the assistance of a second instrument, the anterior edge of the corneal stromal pocket was elevated to allow for easier insertion of the inlay and the forceps. Of note, it is important to make sure that correct plane identification is achieved, not to disturb the LASIK flap, which is anterior to the corneal stromal pocket. The inlay and the forceps were then advanced until centration of the KAMRA inlay was achieved. Of note, countertraction can be used here when trying to retract the forceps without disturbing the centration or placement of the KAMRA inlay.